Hi, I am doing my class presentation over Chapter 4, the Ethics in Public and Community Health Nursing Practice. The objectives that I chose to cover in this presentation are number 1, discuss ethical decision-making processes. Number 2, compare and contrast ethical theories and principles, virtue ethics, caring ethics, and feminist ethics. And number 3, describe how ethics is part of the core functions of nursing and public health. Starting with objective number 1, discuss ethical decision-making processes. I've listed the definition as the processes of how decisions regarding ethics are made, and that moral issues are common in community and public health, and the nurse is tasked with making ethical decisions routinely. I listed out the generic framework for making ethical decisions that's located in our textbook on page 52. And it starts with identifying the ethical issues and dilemmas, then placing those issues within a context that is meaningful. You want to gather all the facts, reformulate the ethical issues if necessary once you've gathered the sufficient facts, consider all available options and actions, then make the decision and action, and then evaluate that decision and action. An example of an ethical issue in the community would be Ebola. It's an example that is listed in our book as far as informed consent for healthcare providers and the community concerning the risks of contracting the virus and what those implications would be on the health and well-being of both the individual and the community. When we're talking about ethical decision making, the consequence to making a decision that doesn't line up with your values would be moral distress. I included this in my presentation. The definition of moral distress is the result when one is not able to act in a way that one believes to be right. This can lead to feelings of personal failure and work dissatisfaction. I felt that it was important to include this because it does have steps to address moral distress in the event that this does occur. You'll want to identify the situation that led to the distress, communicate with your manager ways to work towards addressing the stressor, seek out support from your colleagues, connect with resources. A lot of I think all facilities have ethics committees, social workers, pastoral care, etc. And be proactive and express oneself on matters that are concerning ethically. My second objective was compare and contrast ethical theories and principles, virtue ethics, caring ethics, and feminist ethics. I've listed all of the theories that I chose to include in my presentation: consequentialism, utilitarianism, deontology, distributive justice theory, and some subsets of that, virtue ethics, care ethics, feminist ethics, and then the principles: respect for autonomy, non-maleficence, beneficence, and distributive justice. I did include on slide number 7 a learning activity where I have the definitions or characteristics of these theories and principles on the right-hand side. I have it to where you can click and drag, almost like you had created the text boxes, and click and drag those to the appropriate theory or principle that's included on the left-hand side. So if you do that, that'll be a good way to test your knowledge on these, because I know we did cover ethics a little bit in one of our previous courses, so this will be a good activity for you to test your knowledge. So on slide number 8, I have the answers, so it's just something for you to do, test your knowledge, and then the answers are provided for further study on slide 8. I did do a Venn diagram comparing and contrasting consequentialism and deontology. Consequentialism is a decision that's made based on what would cause the greatest good and the least harm as far as the outcome goes. The deontology theory is whichever action is the right action, regardless of what the outcome would be. So both of these, to compare them and as to what they have in common, adhere to individual moral values, and they both focus on actions and outcomes in different ways. So that's my contrasting of those two theories. Then on slide 10, I did another Venn diagram with virtue ethics, care ethics, and feminist ethics. Virtue ethics is practical reasoning in relation to character traits. Examples would be benevolence and compassion. Feminist ethics, these are advocates for equity in political, social, and economic areas. And then care ethics focuses on the relationship between the patient and the provider, and emphasis on connection and caring. I've also listed some areas to where these ethics overlap. As far as feminist and care, they both have morality of responsibility and relationships in common. Virtue and feminist both have communitarian, they're both considered communitarian theories. And then both virtue and care, I felt that trustworthiness was a good component that they both have in common. I did include in my notes, be sure to look at the notes at the bottom of the slides. Examples of how to apply all three of these theories are located on page 56 and 57. On Healthy People 2020, I chose AHS to increase the proportion of insured persons with coverage for clinical preventative services, and AHS 4 increase the proportion of practicing primary caregivers. Both of these reflect important ethical considerations in regards to community. Talking prevention, primary prevention with ethics is to follow the code of ethics for nurses to guide your nursing practice. Secondary prevention would be to take steps to correct behavior if you're not able to follow the code of ethics for nurses. Tertiary would be to seek guidance on other choices that you could have made if you acted in a way that was not consistent with the code of ethics for nurses. I apologize. I'd skipped the nursing role in ethics, my slide 12. So the nursing role in ethics, I did look up the recommendations from the ANA, the American Nurses Association, and they recommend that nurses advocate for their patients and communities, advocate for ethical and just practice of nursing, examine and promote discussion of conflicts with personal and professional values, and embrace concepts of justice and caring. If you want to read more, because I only chose a few examples of the recommendations, it is included in my reference page at the end of my PowerPoint. The greatest takeaways from this chapter, I believe, are that nurses play a huge role in ethics and ethical decision making. There are many theories and principles that can serve as guidelines to make morally sound decisions. Ethical decision making has effects on the community, and public health advocacy involves ethical decision making. Okay, right, I thank you for your time. If you have any questions, I will do my best to answer them, and you can put those in the discussion board area. All right, thank you for your time, and have a great day.